over the years, I've come to have a clearer and deeper appreciation about the giftedness and the goodness that lies in the Filipino. And nowhere do you see this goodness and giftedness better demonstrated and better in action than in healthcare.
As a physician, Alfredo R.A. Bengzon has been trained to diagnose what ails a patient so that he can prescribe the appropriate cure or medical advice. But Dr. Bengzon has trained his eyes not only on what ails individuals, but also on the bigger picture of what can be done to improve the health and lives of Filipinos in general. His life's work is anchored on building institutions where committed individuals can come together to work for the good of the nation.
The Filipino health professional has all of the giftedness, okay, to make the health systems work. And so the question is, why is it that in our own backyard, we don't see that thing as a reality? So there is this mismatch because we don't know how to build institutions. Okay? We shape individuals to become very knowledgeable and very skillful. But skillful and knowledgeable individuals by themselves cannot lead to the translation into reality of health as an important basic human right. You require staging areas, which is what institutions are all about.
In different capacities, Dr. Bengzon has sought to build and strengthen institutions of service for Filipinos. As secretary from 1986 to 1992, Dr. Bengzon worked to reform and reinvigorate the Department of Health. Under his watch, the Philippine National Drug Policy and the Generics Law were vigorously implemented. But Dr. Bengzon's service was not limited to health. He was also appointed Peace Commissioner and Vice Chair of the negotiating panel of the President's Committee on the U.S. Military Facilities. After his stint in government, Dr. Bengzon returned to the medical profession at the Medical City. But in his heart, he knew that it was time to build anew.
One of the things that I understood as a result of my exposure in the public sector was that the Filipino attitude about government needed to be revised. You know, most Filipinos think that government is not something you want to get into. And so I thought that perhaps we ought to change our attitude toward government. And so I went to see Father Bernas, who was then president, and suggest that my beloved university, the Ateneo, should perhaps consider having a presence in this sector called government. In 1993, Father Nebres asked me if I was still interested in pursuing that project, and I said yes.
As Dean of the Ateneo Graduate School of Business and Vice President for the Professional Schools, Dr. Bengzon emphasized to the community that the entire country was its business and its commitment was to nation building. The professional schools enthusiastically pursued this commitment. However, Dr. Bengzon knew that there was one more school needed to complete the service capability of the Ateneo. It was time to build the Ateneo Medical School.
At that time, about 1998, 1999, the Medical City, to which I had returned, needed once more to expand and upgrade itself. As the opportunity became available in the Meralco compound, the space was larger than what we needed. And so almost as an afterthought, the people I was talking to who owned the land, I raised to them the possibility of what would you think if beside Medical City was a medical school? And then I said, what would you say if I told you that the name of the medical school would be at Ateneo Medical School? And they said, let's do it. At that point, I had absolutely no authority to say something like that. I was just fishing. Eventually, I presented to the Board of Trustees a different concept. The concept was to produce a different type of doctor. A doctor who would be a leader, who would help develop a new way of thinking and feeling and acting on health.
The Ateneo School of Medicine and Public Health is now a reality and will soon graduate its first batch of Ateneo doctors. But for Dr. Bengzon, the task of building is far from over.
My dream and my passion is that those of us in the health sector and those of us in the Ateneo come into a recognition that this goodness and giftedness that has been given to us is both an invitation and a command to put these gifts in the service of our country and our society.